What shouldn't you do if you have rosacea? Welcome to the video guys, I hope you are doing well. In this video, you will learn about rosacea, a face skin disease. So watch the video till the end for the full detail. Let's start. What exactly is rosacea? Rosacea is a skin condition that causes blushing or flushing and visible blood vessels in your face, as well as small, pus-filled bumps, a burning sensation, eye problems, and an enlarged nose over time, according to Dr. Marcelo Bonarman Pereira, specialization in clinical cardiology, 12 years of experience, Brazil. Dr. Robert H. Merling, MD, Senior Faculty Editor, Harvard Health Publishing, USA, tells the following critical aspects regarding rosacea based on his 30 years of expertise. Triggers that worsen rosacea. The causes of worsening rosacea differ from individual to person. If particular foods or exposures, such as spicy foods or alcohol, seem to aggravate rosacea, it makes sense to limit or avoid them. In any case, you should avoid hot drinks, spicy meals, alcoholic beverages, smoking, dairy consumption, and foods high in histamine, such as citrus fruit, beans, chocolate, and nuts. Keep a record for 2 to 3 weeks detailing when your skin flushes or your rosacea worsens. Recommendations from experts. In addition to other measures, doctors advise avoiding the following. Unprotected sun exposure. Sunscreen and other sun avoidance precautions are advised. Irritants. It includes skincare products containing alcohol, camphor, perfumes, or astringent. Traditional soaps. Non-soap cleansers, such as liquid face cleansers, are preferable to traditional soaps. Scrubbing the skin or using exfoliants in extremely cold or very warm environments are just a few of the things to avoid if you have rosacea. A doctor may prescribe skin creams and gels. It's also crucial to avoid wearing cosmetics on your eyes, particularly if it's contaminated with bacteria. These steps may not be sufficient to manage the problem, so consult with your dermatologist about not just what you should avoid, but also what you should do, including therapies that may be useful.